Hello and welcome back to my YouTube channel. My name is Ini and you are watching Parenting with Ini, where I get to share my parenting experiences as well as give the platform to other parents to share their experiences as well. So you're very much welcome. If this is the first time you are stopping by here, you're very much welcome. Please click on the subscribe button if not yet subscribed and turn on the notification bell. I'll be so happy to welcome you to this amazing family. Most pregnant women, if not all pregnant women, do desire to give birth to their babies through vaginal birth. But at times, some of them end up doing CS, either by choice or situation. But I honestly feel like there is nothing wrong with whichever way God allows you to give birth to your baby. Is it vaginal birth? Is it CS? What really matters is the baby here? Is the baby alive? Are you alive? Are both of you healthy? I think that is what we should mostly be focusing on rather than how did you give birth to your baby. We understand that we desire to do it vaginally, but God has the final say in all these things, and allow his will to be done, okay, in your journey into parenthood. So in today's video, we actually have a guest in the house who will be sharing with us self-care after giving birth to your baby through CS. I did a video on self-care after vaginal birth, but today I have a guest who will be doing a video on self-care after giving birth to your baby through CS. She is Faith Imani Kiteki. She is a mom of one and an amazing lady. I would love you to give her the attention as she gets to share with us on how women can take care of themselves, especially after you have given birth to your baby through CS. So sit back and let's learn from Faith Kiteki today.
Hi everyone, and how is everybody doing? My name is Faith Kiteki. I am a mother of one. A boy is about to turn 2 and I'm so excited about that. And I just want to say thank you so much, Ini, for the consideration to have me on your show, for the opportunity to discuss something that is going to help many moms, especially mothers who have gone through a C-section. So I'll just be talking briefly about how to take care of yourself, especially after a C-section. Okay, bringing life to this world is itself a miracle. It's an exciting, I think it's really exciting to just, bring a little human being to this world. So we do that differently. There are mothers who go through the vaginal delivery. We also have mothers who go through a surgery procedure, which we call the C-section. So how do you take care of yourself after a C-section? Number one, you have to take plenty of rest. That is an advice I was given by my doctor, especially after I gave birth, during, after the C-section. And one of the things that the doctor said is, you have gone through a major, stomach surgery. And, I just want to talk to women who have gone through the bikini surgery, which is the operation is done just slightly below your belly button. So that is a major surgery, and sometimes we feel like after 6 weeks we are strong enough to do much, but it's really advised that when you get home, please take a lot of rest. The only weight you can lift, especially the first 6 weeks, is just your baby. So take a lot of rest, ask for help. Okay, there is no shame in asking for help. Please don't lift anything that is heavy. So your body will need time to heal. And here is the thing, the anesthesia that they inject on your lower back has something that we call spasms. So I'm not so sure if that's the pronunciation, but it's spelled spasms. So if you're not able to take care of yourself, especially your back, and you start lifting heavy things, bending now and then, that is why many women complain of really bad backaches after a C-section. So it's very advised, highly advised, that you really take a lot of rest. All right. It's very important also to take walks, especially after a C-section. You don't want, blood clots forming, on your incision part. So take a walk, every day. You can do 10 minutes, 15 minutes, because you really need to get that area, healing quickly. And one of the ways is just walk, 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 walk. That ensures that the blood clots do not form. When it comes to cleaning that area, again, we have different hospitals, I think, perform different, procedures when it comes to closing up your wound. There's some women who will go home with some bandage. Others will just, there's a medication that they just spray into your wound, is very okay. So depending on what they did on your wound, it's very important to keep your incision area very clean. And what do I mean? After you've taken a normal bath, it's important to take a normal, bath when you get home. Ensure that you pat the area dry. All right. This ensures that no infections on the area. It also ensures that the place is very clean. Allow me to talk to the women who are plus size. Sometimes you will find that after the C-section, because of your belly, sometimes the belly may be just, might hide the incision area. It's important that you do not overdress, so that you ensure there is air going in and out. Even to women who are petite, just ensure that you don't overdress, because the warmth is not good for your incision area. Sometimes just, let it open. And what I mean by that is, ensure that the place can get air, and pat it, clean, and just take the right medication that you are given. Sometimes you might be tempted to overdose, by the way, because of the pain that you might feel, especially the first few days. Take the right medication. If there's any medication that you are given to spray the area, ensure you do that. And by taking enough rest and just ensuring that place is clean, you will be doing great to yourself. All right. I hope so far I am helping somebody. All right. Remember, the only weight you can lift is your baby, especially the first 6 weeks. Okay. There are times, okay, you might need to cough or sneeze, and this is very important to the C-section mothers. If you have to cough or sneeze, please take a pillow and just place on your incision area. All right. What that does is, you see, your tummy is built up of muscles. So if you stretch them, remember at the same time your uterus is still trying to contract and go back to the normal size, there's a lot of pain that you might feel. But just placing on a pillow on the incision part, it feels better when you sneeze. All right. The other thing is, like when you're holding your baby, one of the things that make many women, especially who go through C-section, have really crazy backaches, is how you hold your baby when you are breastfeeding. Some want to lie forward so that you are able to watch your baby. It's very advised that in as much as you're still using your nursing pillow, please lie at the back. Try and keep a straight back, and then you can now hold your baby so that you don't get really crazy backaches, and also you're not lying on your wound. I hope that also can help someone, and also it prevents this, blood clots. It also actually helps reduce constipation. Talking of constipation, it's highly advised by the time you leave the hospital, just ensure that the doctor has given you some medication that can actually help you with, in case you're going to get constipation. These are like medications or supplements that are high in fiber. It's very, highly advised. And also that definitely will help, relieve any pain that you might feel, as you get back to the right nutrition, which again, I can't emphasize enough. Please eat, and eat healthy. All right. Take a lot of fluids, drink a lot of water. All right, because we'll need those, extra fluids to boost your breast milk supply, and also will help you with constipation. Allow me to talk to you about like the times that you might need to call your doctor. All right, because probably you might start feeling soreness in the incision that does not feel normal. And good thing is, as a mother, you have the guts, so you can tell when the pain you're feeling is not normal. So if you are experiencing bleeding on the incision part, or there's a lot of discharge, especially after the 6 weeks. Discharge within the 6 weeks is normal, but if you're experiencing a lot of discharge, mostly like one that smells really terrible, either from your vajayjay or from the incision area, it's very important to call the doctor. If you're getting fevers that are above 37.5, that would either mean that you are getting an infection which needs to be treated very quickly, or maybe the incision area is opening up. So you may need, when you see that, call the doctor immediately. Don't post on Facebook. Run, run to the doctor. All right. If you can see, redness, swelling or pus from the incision area, don't wait. Run to the hospital. There are other mothers who can even start experiencing difficulty in breathing, chest pains, pain that you can hardly explain. You need to see your doctor. All right. There's this very important check that you need, especially after 2 weeks, once you're discharged from the hospital. Please do not miss that checkup. Some wait until 6 weeks, which is okay if you're healing okay, but there are doctors that will advise you to come back after 2 weeks. Please do so. Call your doctor every time you feel like something is going off. Call your doctor when you feel your gut is telling you to. Most importantly, take care of yourself. Eat well, rest, walk around, and you will be fine. Ciao.